ourselves, our loved ones, and ourselves, our loved ones. Perfect timing during this time. I look to you as chiefs, leaders, healthcare leads to continue encouraging everyone to stay safe and healthy moving forward. You've done a tremendous job over the last 2.5 years, and I know that you're able to continue doing that good work. Today, we have a strong group of experts and leaders to provide us an opportunity to ask questions. They want to hear your thoughts, your comments, your reflections. Be open about the support your communities need to continue to protect yourselves and others during COVID-19 and other respiratory illnesses. I'm very grateful for everybody here to taking part in this discussion. It's a very important discussion as we move into 2023. But also remember to bring any concerns you may have to the attention of your First Nations Health Council regional representatives, including myself. We are a source of information and support as we move forward. So once again, I say hi, it's Epcot to each and every one of you. Thank you so much for taking time on a Friday morning to be here to talk about this important information, and looking forward to the discussion. So I will now turn it over to the First Nations Health Authority Board Chair, Colleen Erickson. Hi, it's Epcot.
Colleen.
Good morning, chiefs, leaders, knowledge keepers, and health directors, guests. My name is Colleen Erickson, as said, and I'm the board chair of the First Nations Health Authority, and I'm very honored to have that position. I would like to acknowledge the territory of the Squamish, Musqueam, and Tsleil-Waututh, where I call in from this morning, and thank the people who've endeared themselves to this land since time began for allowing us to conduct this business in their territory. And I would just like to mention that, as a board, speaking for the board, that we've just come off a full round of caucuses, all 5 regions, the last being the North. And I just have to express my appreciation for, the board being able to sit in the caucuses and listen, to all the concerns brought forward by the chiefs and the leaders, about the issues in their communities and in their nations. And but also part of it is that they bring forward, suggestions and next steps, that might, be helpful to the First Nations Health Authority to better do their work. And, I have to say, that it's always a privilege for us to be able to report out to the chiefs and leaders as the FNHA in an annual report. And we always look forward to these caucuses to be able to hear the concerns. And then we bring all of what we hear back to the board table to look at ways to implement change, so that we all realize a better, health system and health for First Nations in BC. So I just wanted to say thank you to all the chiefs and leaders who attended the caucuses, and to say, that it is, a really good place. It's an example of good governance where we hear the concerns of the people, how we can further, the operations of the FNHA. So with that, I say thank you. And I know that today we're going to be hearing updates from Dr. Shannon, who is going to be retiring. And so we wish her very well, in her retirement. And then we will hear updates from the regional VPs. And I know that it's been a little while since we had a town hall, so I'm sure that you'll have lots of questions. So I will just end my comments by saying, that also I know that this will be a first Christmas for many, without a loved one. And, and that's always difficult. And so I would like to acknowledge those who have passed and those who have been left behind. And I know it's important, that you take care of yourself, but also for the community to turn, to help you through this season. So I wish you really well over the season. And I'd like to wish everybody on the call, and your families a very good holiday, filled with abundance, with family, friends, good food, joyful music, quiet times when you need it, and lots of time on the land, and lots of sharing of goodwill. So thank you.
Thanks. I also want to acknowledge that Cliff has joined us. Wiccan and Ish, thanks for joining us. We will create space for you to do a good closing for us and make comments at that time. Also, I understand Keith has now joined us, so I'll now turn to Keith Marshall for his comments and welcome.
Hello, good morning, everyone. Thank you, Richard, and thank you, Colleen, for opening. I apologize. I have to use my phone today because my Zoom is down. However, I'd like to begin by acknowledging the loss of all our loved ones, as Colleen mentioned, our elders, our youth, our parents, and I know all our communities are going through the loss of family members and friends, and just want to keep them close to our hearts. And as they approach this Christmas season, the first four, without having them, we just want to send our best thoughts and wishes out to them as we go forward. I'd like to also acknowledge the traditional territories that we are collectively gathered today, and it's always good to be able to do this good work. My name is Keith Marshall. I am president of the First Nations Health Director Association, regional representative for the Vancouver Cultural Region on the board, and also the director of health programs at Halikas Health Center Society. And I want to thank everybody for taking their time out of their busy day to be here to listen to this important information that's going to be presented today. I want to share how proud I am, and we are as a board of the chiefs and leaders and health directors, our FNHA board, our FNHTA board, and our FNHC board of governance, and other partners who continue to work to support First Nations communities throughout the pandemic. We are now in the process of slowly returning to indoor activities and gatherings, and we, although we have seen a spike in respiratory illnesses, including COVID in our communities, the common cold, flu, RSV, and others are spreading. So we want to ensure that even though we're experiencing higher cases than usual, this is a strain on our healthcare system, but we continue to be diligent and ensure that we get our vaccinations and take the proper steps to keep ourselves as well. Thanks to the masks, the diligent hand washing, and public health efforts by the health directors to keep our community safe during COVID. Many of us have not experienced exposed to seasonal illness yet, but as you can tell, my voice is a little raspy. I'm just getting over a little bit of a cold myself, but we want to continue to ensure that we can, if you're exposed to these illnesses, we can continue to work with you. We know that hospital cases are rising, especially with children, so we want to make sure that we protect our children. The impact of increased illnesses causes us to use our lessons learned and during the pandemic to help our children, our elders, and other community members to stay healthy as well over the fall and winter months. We as health directors continue to lead the communities through this surge by arranging vaccine clinics and assisting and encourage members to get a flu vaccine. Looking forward to today's COVID-19 and dates on the current status of COVID-19, and looking forward to the information on the medication shortages and that pharmacies are facing, but hopefully that those can be addressed. And as Colleen wished everybody on the line, a very happy and blessed Christmas. And thank you. Back to you, Richard.
Thanks, Keith. And like to acknowledge that our team today is calling in from Squamish territory here in West Vancouver in the Black Tower, and that we have several people here in attendance in the room and in the overall facility. Also want to acknowledge that that this is a busy time. There are many meetings underway, and our attendance is lighter and likely is lighter, will be lighter throughout the call. However, what we will do is record this and then make the recordings available and send out a notice to all chiefs and health directors that the information has been captured, so that we're making the best available use of time. At this particular time of year, there's almost no good time to have a call. But I think the information really needs are what's important, and we'll do our best to provide an update on what information is available. So with that in mind, I'll turn to our Chief Medical Officer, Dr. Shannon McDonald, to give us an update.
Thank you, Richard. Good morning and welcome to the call from where I am at Say First Nation, and hopefully people are staying warm and safe wherever they are. Thank you, Colleen, for your words and your prayer. And I especially want to thank people who have hosted us over the past several weeks at caucuses all over the province. It's been a wonderful opportunity to see people face to face, to hear their voices, to have some fun, and meet new people, and I really appreciate that. I do apologize. I was supposed to be off today, made a dentist appointment, and then this was booked. So I'm going to have to leave at about 10 o'clock. So if you have burning questions for me, try to squeeze them in early. Thank you. Can you put that on slideshow from the beginning, please? So I want to thank Dr. Cam Golmati for helping me out with these, because I've been away. I haven't had a chance to prep things for today, but there's a few things I wanted to show you, because I think there's a lot of people that are concerned about what's going on and really don't understand what's going on around respiratory illnesses. But you have to think about this in terms of, this is cold and flu season, and no matter what year we're in, it's an issue. Next slide, please. So this is a slide that talks about community visits due to respiratory illness symptoms in BC. So this is everybody, not just First Nations and not just our community health facilities. So if you look at that red line, you can see that in comparison to the gray line, which was sort of the standard over the last few years, we still haven't reached cold and flu season at its maximum. In January of 2022, of course, that was the big COVID spike, but we're seeing that rate of respiratory illness come back up significantly. And everywhere I go, I see people sniffling, coughing, snorting, especially the kids. Next slide, please. So I don't want you to worry about this whole thing. There's a couple of pieces. Top left, the green chart shows you the COVID rates for all of BC. And you can see again that big peak in January of 2022 and how it's come down significantly. The red or the green is quite a bit lower than it has been in the past. Below that is influenza. And right now, the most active kind of influenza is influenza A. It is well controlled by the flu shot, but a lot of people haven't gotten their flu shot yet. So you can see that real high bump starting in November and continuing to rise about influenza. The lighter green, sort of in the middle to the right, is respiratory syncytial virus, and that is a virus that most commonly attacks young kids. In previous years, children are usually infected with RSV at some time in the first 2 years of their life, because it's out in the community, it's there everywhere, especially if they have siblings that are in school. RSV can be brought home. But we have kids from 0 to 5 years old now who have had very little contact because of the isolation and other public health actions over the last couple of years. They have not had the opportunity to build an immunity to RSV. So that peak that we're seeing in November of 2022 is likely to continue for a little while yet. The top right is enterovirus or rhinovirus, which is the common cold. So on top of all these other things, this is respiratory season, and the common cold always increases in the fall. Interestingly, though, not as significantly. It's more in a normal range. Next, please. And again, this is the age differences in all of the respiratory illness that is requiring physician services or health services. So if you look at this down at the bottom of the chart on the right, the November 2022 numbers, the elders, so I'll include myself in there, the yellow and purple lines on the right-hand side, you'll see that those rates are actually quite low in the elder population, many of whom have been vaccinated both against flu and COVID. But the younger populations, the 0 to 4 and 5 to 9, so the lighter blue on the right is where we're seeing significant rises in infection. Next, please. So our surveillance team just gave us this, and I think it's a really significant slide. And this is talking about the differences between people who are unvaccinated and people who are vaccinated with 2 doses and people who are vaccinated with 3 or more doses. So if you look at the far left-hand side, there is the hospitalizations between January and September of this year. 4 times as many people hospitalized were unvaccinated compared to those that were vaccinated with at least 2 doses. When you look at the middle, the critical care, so that's the ICU, 5 times the rate of unvaccinated versus those that were vaccinated with 3 or more doses. And on the right-hand side of that chart, that were the deaths, 30-day mortality, where the cause of death is specifically COVID-19. And for those of you that were at the caucuses, you'll know I tried to explain that they kind of changed the way they keep track of deaths, whether or not somebody died of COVID or whether somebody died with COVID. So sometimes people have been in a car accident and still tested positive for COVID. That's a different set of numbers. This is specifically people who have died of COVID, and a 4 times difference between the unvaccinated and those that were vaccinated with 3 or more doses. So really significantly showing not only that vaccination is very successful at keeping people out of hospital, but the 3 or more doses is also very effective. So really wanting to have people consider vaccination at this time. If it's been a year since you were vaccinated with your 1st and 2nd dose, the ability of those doses to keep you well has decreased significantly. And you really need to think about getting out there and getting that booster. Next, please. So measures to protect and promote wellness, and none of this is new. We need to talk about getting the COVID-19 vaccine, getting the flu shot. You can get them both at the same time. So schedule your vaccines. Stay at home if you're feeling sick. I've spent a lot of time in airports over the last while, and there was a lot of people coughing and choking and blowing their nose. So I really appreciated when people were masking if they were coughing, masking up in crowds, and especially if you can't maintain physical distance, coughing or sneezing into your sleeve instead of your hands. Washing your hands well for at least 20 seconds, use soap if you got it, and try not to touch your mouth or your face. And then have a conversation with your health professional with questions. So the next slide, I think, is the thank you slide, but I still want to talk about the issues about the medication. So the shortage of medications for children and analgesic medications, so things like Tylenol and Advil and Motrin, they are in severe shortage Canada-wide. For whatever reason, my pharmacist said they have about a 3-month backlog from their orders where they haven't been receiving those. Now they're having shortages of cough and cold medications that contain those products because people are thinking, well, you know, it won't hurt that this way the kids will at least get the Tylenol for a fever and pain. But even those are in short supply now. Some people are crossing the border, and I've seen complaints of the Northern Americans stores where Canadians are going down and emptying the shelves. So that's a problem for them as well. But one of the things I want to talk about clearly is that even though it's online, and I've seen it all over the place, people cutting up adult doses and using them for their kids, I strongly do not recommend it. When we order medications for kids, we base it on their weight and their ability to take those medications safely. Cutting up a Tylenol that's in your cupboard for you may not be the right dose for your child, so there is a significant risk. And we wouldn't want kids ending up ill because they had been given an improper dose. But our health benefits team has worked to approve compounded versions of those medications. So what that means is that you can go and talk to your pharmacist, tell them this is what you need, and if they have supply available, and most do still, though the shortage is getting scarier, they can put together a liquid version that is the right dosage for your child. And those are being covered on a temporary basis, at least, by our health benefits program. So I really want to encourage people to be careful when they're giving children medication, to not give children adult doses of medication, despite some of the advice that may be out there online. It looks like, my understanding from my partners at Health Canada, that this shortage may last us well into January. I recommend that people, be really cautious. And I know it's really hard over the Christmas season because everybody wants to be together with family and gather and kissing babies. I was posting something the other day about say hello to baby, but please, please, please don't kiss baby, and make sure that you have your hands washed because those kids are at significant risk with RSV. And I'm really hoping that everybody stays well through the next period. You know what to do to stay safe from respiratory illness. You've done it so well over the last couple of years. And I really want to send everybody best wishes for your holiday season, and to do what you can to stay well and to keep others around you well as well. So thank you.
Shannon, and I just want to note that our VPs with different responsibilities are on the call and will be available to help address
Love you, little
any
guy.
questions.
Go to school. Go to school.
So that's one part. We'll do some brief reflections by the regional VPs, starting with Michelle DeGroot in Fraser region, who's here in our offices. Michelle.
Colleen, for opening us up in a good way. Especially thank you, Shannon, for all that good information. I really appreciate understanding the situation from the provincial level. My team has shared some information with me about our regional team. Just seeing the stats around how supportive the vaccines have been is really important. For myself personally, COVID did find me last month, but I'm very grateful. I did have 4 vaccines and my response was really good. And I know we're still out there in vaccine clinics and supporting our communities to be able to do that. And I think that it's really important. So for those of you, sorry, I forgot to introduce myself. My name is Michelle DeGroot. I'm from Tecumseh to Sequatma, the VPRO for Fraser Salish. And we have a team in our region that can help support the 32 communities in our region. If you are having issues running a clinic or being able to get support from Fraser Health to do so, I understand there's some issues with registering for flu shots, some of the same things we've experienced over the last few years. Please do reach out to our team. Gary or Alexis or Sam, and we can help you with any issues you may be encountering. I know we're hoping that our communities could continue, but given it's been a long few years, people are tired, and we continue to experience a lot of these diseases that do take a lot of our time to respond to. So in addition to having options for vaccines, just encouraging people to get rest and to take care of yourselves and do the best you can. Sometimes you just need to stop for a bit and take care of yourself and take care of your family. So I encourage you to do that, and appreciate the time to gather before the holidays. Wish all of you the best for the season. Merry Christmas, Happy New Year, and warm hugs to all of you.
Thank you, Michelle. We'll now turn to Brennan McDonald from Vancouver Island. Brennan.
Hi, Tka and Squil, everyone. It's nice to see you. I'm Brennan McDonald. I'm the VPRO for Vancouver Island. I come Coast Salish. I come from Cowichan, and I'm calling in from snowy Stamanas territory today. Vancouver Island is having a bit of snow hit us, which is nice, but it's definitely different for us on the island. It's good to be here. I want to thank Colleen. Thank you, Haichkasiam, for the prayer this morning, acknowledging our chairs who've joined us, Health Council Chair Wade, Health Board, FNHA Board Chair Colleen again, and FNHDA Chair Keith. Thank you for being with us and offering your leadership and support to our work. Thank you to all the speakers before. Shannon, the information you share always keeps us grounded and gives us confidence in our way forward. So I really want to thank you for your good work, and know that change is coming, but just so thankful to have you with us today. I want to say that our nations have recently gathered, as we have across the province, for caucus. Lots of information shared on all of the good work that's happening. So appreciating the opportunities to come together to support one another. Our work does continue, however, and I think in response to COVID, we're continuing to lend our support to communities as we push forward with additional vaccination clinics. We're seeing less requests for FNHA teams to be in community helping. I think our nations now, this is, the 4th round of boosters that we're offering, and there's very much, I think, a developed capacity and understanding of what needs to be done. So want to just offer that we remain available to help if the help is required. We have seen some strain on accessing vaccinators for surge capacity in clinics. This is not just our communities, this is with Island Health as well. So our team is aware and working to connect with additional staff if that's needed. So just want to put that offering forward. We are seeing anecdotally a rise in the respiratory illness. So the town hall is timely. I think it's always good when we're starting to see trends happen that we circle up and come together and ground, our knowledge and understanding with those who have this expertise. So our medical officers providing that data really gives us good information to work from. we are always encouraging, of course, if people are unwell to stay home. And I think just seeing that happen in our communities, we've been through this now for a couple of years with COVID, and those messages of keeping ourselves and our families safe has been so strong that we're seeing this even in my own community, having a very large Christmas gathering last night. There was quite a few that didn't come because they weren't well, and they made a good decision because it's about protecting our families and our elders and our young ones from the illnesses that are circulating. We also on the island, of course, are impacted by the illnesses, or sorry, by the interest to find pediatric medication. So really great news to hear the health benefits coverage of the compound formula. So we will be available to support nations in accessing and understanding how to access this. If you have questions, encouraging you to reach out to our nurse practice consultants, our nursing team, and we'll be on standby to assist you. I also want to just make mention that we have kind of mentioned the weather, but we are really seeing some significant colder weather hit us. And the snowy conditions and wind chill, we're seeing -5, -10 on the island, which is not typical for our region. So this is bringing some impacts to our most vulnerable population, those that are unhoused. And while I know this town hall is not necessarily touching this, I just want to offer that it is something that our region is discussing. There will be information coming out to our leadership on what individuals can do, what communities can do as you want to establish some of the warming shelters that are needed at this time. And we will share some information on what supports are available through some of our partners and Regional Health Authority and EMBC and so on. So I just want to really offer my warm greetings to each of you as well, sending my very best wishes to each of you and your families and communities at this time, and really look forward to continuing our good work together in the new year with fresh energy and good feelings. So, Heights Apka, siap na siya, yeah.
Thanks. I see you emphasize the warmth there, so that's good. Brennan, over to you, Julie Morrison from the north.
Amahilo, I'm Ansasibans. Good morning, friends and leaders and co-workers. I'm calling in today from the Lheidli territories in Prince George. I'm the VPRO for the Northern Region, and I'm Gitsan. My Gitsan name is Gusagetch. So I'm very happy to be able to join everyone today. Yeah, so for our Northern Region, we've been, like every other region, going through challenging times for our First Nations communities with increased illnesses, losses, and staffing needs with nursing and other positions. We're expanding our point of care testing to include RSV and influenza in our remote areas, the Gene Expert instruments, and working closely with our OCNO partners, nursing teams, and communities to work through the necessary updates. And then we have a large appreciation for our Shipping North team that have been working so hard to get the additional community-based testing supplies out to our communities. And we've also, there's no shortage of products for the flu or COVID immunizations in the region, which we access through Northern Health Authority's biological ordering pathway. Some of the strengths we have, like throughout the pandemic, our relationship with Northern Health was strengthened, and that continues to be the case, that we're working very closely with Northern Health to address issues and concerns in a timely manner. We have regular meetings with the Northern Health medical health officers who are closely monitoring situations that arise from our communities. And I was also glad to hear about the opportunities for pharmacists to provide Tylenol for children, because that has been a huge concern in so many communities. And we're hoping that the medication shortages will be for time limited, and that families can also continue to work with pharmacists and nurses to decide what is the best course of action for the family and the young child. And the Northern Region is working with our FNHA pharmacists and additional procurement avenues and vendors to acquire the necessary medications. So if communities are experiencing challenges with access to pediatric analgesics, which is Tylenol, Advil, etc., please reach out to our email, which is northernnursing@fnha.ca, or to our regional nurse manager, Laura Moore. They will work with our provincial team and to advocate for supports from ISC for our communities that are experiencing challenges in this regard. So for our Northern Region, we just want to extend our best wishes for the year ahead, and to all of the leaders and people on the call, that we do need to make sure we take time for ourselves to be healthy and stay healthy, and also to in whatever we do, practice kindness. We know a lot of people are going through challenges, and sometimes you can't see it, but it's there, and they may not want to share it with anyone, but they're going through tough times. And we know that the Christmas holidays are challenging for some. So we just need to make sure we're there for everyone and listen when given the opportunity, when someone wants to share their personal feelings and challenges that they're going through. So with that, I will leave it there, and thank you.
Thank you. I'll now turn to Brent Tom from Vancouver Coastal.
Thank you, Richard. Good morning, everybody. I just want to start by acknowledging Colleen and thank her for opening us up and grounding our space this morning. And also Dr. Shannon, I hope this could be, I guess, maybe our last town hall with you, and just want to wish you well as you transition into another chapter. So I just raise my hands to you for your leadership. And for those folks who don't know me, my traditional name is Theistis. I'm a proud member of the Tla'amin Nation, and I'm the Director for Health Emergency Management with the Vancouver Coastal Region. And today I'm calling in from the unceded territories of the Squamish peoples at our FNHA headquarters. I send regrets for my fearless leader, Kim Brooks, who is on some well-deserved leave at this time. So just wanted to acknowledge that she had planned to be here, and acknowledge our shout out to our regional table members, Wade and Maria and Jessica, who are on the call. In BC region, we are just off of 2 months of really good engagement and reconnecting with our community leadership through our sub-regional and regional caucuses. It was the first time in our region that we gathered in person since the fall of 2019, and it was certainly a really great opportunity to reconnect on some of our priorities, but it was really beautiful just to see leadership reconnecting as peers, and it was good to bring culture back and ceremony back, and it was a really good, and I think it brought a lot of wellness, I think, to our leadership. So I just wanted to acknowledge that. I want to recognize our regional nursing team, who have been fantastic, and in building relationships and making connections, and really committed to engaging our communities, spending more time with our communities, so that at each chapter of this journey with COVID, and most recently with the respiratory illnesses spike, they've been really fantastic and well connected to our community nursing teams. They work very closely with our FNHA provincial teams, and are well connected. We've also we continue to stand up and support the community COVID-19 planning tables, which have really become a wise practice and approach for us in the region, because it brings the right people around community, so they can have some of their concerns and some of their unmet needs sorted out. In our region, we have heard concerns from communities, from families around the shortages and how it's impacting their homes at this time. And I just want to, for our communities that are on the call, there's really no door is the wrong door. I would say reach in to the staff that you are currently doing work with, reach out to our nursing team, really, and we'll make the right connection and follow up accordingly. And then just in closing, we're going to be sharing, a mental health and wellness focused e-bulletin, just to talk about our holiday coverage, and just to offer a bit of information and resources, acknowledging it's been a tough, few years. Our communities, for various reasons are still experiencing grief and loss, and so just sending extra prayers, for those individuals on the call, and those communities just in extra need of a bit of lifting and a bit of prayer and a bit of wellness at this time. So with that, I will hand it back to Richard, and I just want to wish everyone a safe and happy holiday season. Thank you.
Thanks, Brent, and bringing us to a conclusion of our presentation period, over to Casey Neathway from Interior. Casey.
Thanks, Richard, and thanks, Colleen, for opening us up in such a good way. For those who don't know me, my name is Casey Neathway. I'm a regional director with the FNHA Interior region, and I come with regrets from Lisa Montgomery Reed, the VPRO, who was unable to make it today. Similar to what we've heard from the other regions, certainly within the Interior, we're hearing from health directors and community leaderships an increase in respiratory illnesses, including amongst their staff, which is putting additional pressures on that challenge capacity that they already have to support their community members. Certainly our region is here to support, including with immunizations around both COVID and flu. We're very happy with the partnership that Interior Health has brought to the table in their biologicals department. We know how in demand flu vaccine is this year, and we've seen some really good magic work to get people, as much as is literally possible within the province. So a huge shout out to our partners for working in good partnership there. And going back to that capacity within the communities within the region, FNHA is here to support and make sure the communities have what they need to hold those COVID vaccination clinics in a good way that's safe for them and safe for their members. And we know that there's not always a desire to go to those provincial clinics for various reasons. So whether that's in terms of supplies, like Julie mentioned, or making sure that they have bodies to do the immunization, or supports to get elders and members to those clinics, we can certainly help out with that, and we're available. We're about 2 days now from the 1-month anniversary of the opening of the Williams Lake Wellness Center, the First Nations Wellness Center in Williams Lake. So November 4th was a grand opening, and we're really excited about this. It's the first standalone primary care facility in the region, specifically for members of those First Nations communities around Williams Lake, the 3 nations there. And it's really a great opportunity for culturally safe access to primary care services in that part of the world. We hope that having access to this center continues to improve primary care for individuals in the area, and we know that there's huge issues with attachment to GPs, difficulty in accessing those services, and having a place that's now safe and accessible and really supportive of community needs is really exciting for us. And I think just echoing what we've heard, now is the time for folks to be cautious. And as Brennan noted, if you're not feeling well, avoid those gatherings, staying home if you're sick and washing hands and all those things. And certainly our region is here to support communities wherever they are in the process. Thanks, Richard.
Thank you. And we're now ready for the dialogue portion of the call. So if we can get individuals to use the Zoom raise hand function or type your question into the chat box. We will go through the questions and do our best to answer those over the next hour. So we're ready to start taking questions, and as is customary, we'll take questions from Chief and Council members first, then take questions from health directors. So the floor is open. I don't see any chiefs, so I'll turn to Janice George, Health Director from Staalis. Janice?
Elatis, good morning, everyone. I thought I'd take the healthy risk and raise my hand, even though I'm not a chief. I just have a question. We have our registered nurse here who works closely with the pharmacy and received the ratios of how to mix children's medications here in the health center. We haven't actually done that. We thought it might be if we're in dire need, but I just wanted to hear from Shannon about if there's a liability there or if you recommend us doing that.
That's a great question, Janice. And I think you've gone through this the right way. The nursing team has gone to talk to the pharmacist and talk about how that could be done safely. And getting that recommendation hopefully in writing so that it's around for when you need it, because it would be easy to forget in a stressful situation. I'm actually going to ask Cindy Preston, our pharmacist, unique and wonderful, if she would answer this question for us.
Sure. So I'll do my best because it is talking about nursing liability. So I'm not versed in that. So I maybe Monica may want to jump in after. But as far as, the supply is coming onto the market. We've phoned around this morning and we've learned anecdotally that there are supplies now showing up on shelves. It's not completely reliable. That it's everywhere and consistent, but we're seeing supplies now showing up in Victoria, in Kamloops, in Prince George. So it means that supply, the imported supply from Australia and the US, are actually showing up on the shelves. So I would really encourage, if that is the first option, is to get the commercial product. And when that isn't available, there are those options. Now, pharmacists have been provided many directions on how to support individuals and families with young children, and on a case-by-case basis, depending what's going to be safest for the family. And in some cases, they may say cut the tablets and use it this way. So I think it is in this shortage. People are doing what they have to do. So it's definitely, when there's a better option, absolutely not. But when it is a very urgent situation, then it would make sense to go that route. But I would put that big veil of caution around it, because it is acetaminophen, even with the commercial products, have a very high propensity for error. And these are the children we really want to take care of. So I don't have I guess that's the best answer I can probably give you. It's definitely not ideal, but when it comes push to shove, and it is a situation where we can keep a child out of having to go to emergency, then I would say that would be a reasonable approach in those cases.
But you would still recommend under the direction of a pharmacist so that you are doing it correctly.
Yeah, yeah. There's so many variations and so many similar looking pills like Tylenol arthritis, Tylenol coated and so forth. It's really good on that case by case basis to involve a pharmacist.
Thank you.
Hey, thank you. Also, we'll ask Monica McElduff to follow up on the nurse liability issue, because I think that's an important element. Do I see Kelly Sport with his hand up? Is that Kelly?
Yes, RG's was ahead of me,
Okay,
but he looks kind of like Sandra today.
yeah.
No, go ahead,
Okay,
Kelly.
Archie, sorry, I'm sitting so far away, so go ahead, Archie.
Okay, thank you. Good morning. I just have a couple questions, and my first one is prescriptions. Who decides what is what, and who makes the decisions? Because we've been talking about how much coverage we are losing, and why is that? If we're part of the big table, why does that happen? And my other question is, every day we have somebody ODing, and it's become so normal that we don't do anything about it. Why not? And my other one is racism. And the thing that bothers me the most is that we come to these meetings and we talk about the same things over and over and over. We never see any action items. Maybe you guys do something, but don't report. But we'll keep raising them until, until we see some positive change. And we need to have that. And the other thing is racism. How far has that gone? Racism is terrible in the medical field, and it happens every day. And I think that, the other thing that we really need to be careful of is First Nations peoples living at home and, living away from home. We can't have that split. We were in a treaty process for years, and we fought against the split, and now we're doing it. And, I really think we need to take a serious look at, what we're doing. We be inclusive, or the living away from home will start, demanding funding so we can manage it. Thank you.
Okay, I'll ask John and Cindy to comment on the drug coverage element. For starters, John and Cindy.
Sure, thanks. Thanks, Richard. And in regards to the prescription question, back in 2017, that's when we created the FNHA Plan W, and we transitioned away from NIHB. And if you remember, there was an evaluation that was done that showed that the prescription coverage was greater than when we were with NIHB. And so I think and we continue to add prescription drugs to the benefit list. So the coverage is also getting more than what we've had in the past. And what I'd like to know, Chief, is that if there are specific areas that you or your community is running into challenges, then I'd like to know and see if there's a challenge with potentially the providers in your area or things like that.
Cindy, do you have anything to add?
No, not at this time. It leads into kind of some of the future work that will be done with the pharmacy providers to make sure that they are supporting patients in BC that people are getting the medications they need, and they'll have more flexibility to address the issues right there in the pharmacy on the spot versus having to send people back to physicians, but nothing else specific.
Do you want us to answer your questions before you do a follow-up, Archie?
Oh, no, go ahead.
Second one with regards to OD, and I think we just had a meeting not long ago, but I do know there's follow-up specifically on the island. Brennan, you want to give a bit of an update on recent developments?
Yeah, thank you, Hitchka Archie, for your comments and questions. We continue to do our work in response to the toxic drug crisis and the overdose that we're seeing in our region. And this work and response is done in partnership with our communities and with Island Health. We did have very fulsome discussions at caucus, and we know there's still more that we need to do. But what we've heard clearly is an interest in wanting to see what's being done. So we do have the plan to have a gathering for our nations to share about the work that's happening in the communities so that there can be an understanding of what has occurred. There's an incredible amount of things that have happened. But what I know is that we also have a ways to go. In our discussions with Island Health, there have been plans in place to look at how we improve access to treatment. And that includes looking at copay situations where NAIDOP, in addition to the NAIDOP centers that we would definitely utilize, that there are other facilities that our nations are looking at. And so that's in the works and in discussion. We're also looking at an additional treatment beds within the region to improve accessibility for our population, and additionally reviewing community proposals related to detox and aftercare and stability. So there are actions that are coming as immediately right after caucus we met and started to put forward some additional proactive approaches. So look forward to reporting more fully on those pieces, but also believe there's a large story to tell of action coming from our communities that having our showcase, our wellness gathering will enable us to do. So thank you for always raising this issue. Appreciate your leadership and passion on addressing what's concerning to community.
Yeah, and if I could, I think the other thing is I'll ask for some brief responses on racism and away from home, but I would like to keep our call focused on our topic. And then if we can use whatever time at the end for additional questions. Because I think there's a certain amount of urgency to get information out about the respiratory season and so on. Just very briefly, racism is making some steps forward. And I believe we've just have passed 2 years since the release of the In Plain Sight report, and progress is slow, but I would say there are advances being made, and our general approach is zero tolerance to racism. And each of the regions is pursuing a little bit different approach to it, but there is focused action on it. And it's acknowledged that we need to work with our partners in this area, as many of the events and occurrences are actually with the hospitals and other services operated by the health authorities. So if I can just sort of leave it at that high level, and also say that the away from home issue, we recognize it. Archie, that you've raised it, others have raised it, and we are taking steps to move on it, including an away from home strategy that we've just started with new positions in each region and new areas of focus. So I just want to keep it at that level for now and be pleased to have, as I say, more discussions later in the call on general topics. But I will ask Brennan to follow up with you, Archie, on the specifics that you raised. Kelly, I see you are next.
I'm first. Everybody's
You're
after.
first.
Good morning, everyone. Kelly Sport, DT Dottie elected counselor, proxy for Chief Brian Tate. I just thought I'd let you know, I'm not going out today, starting to snow again. And anyway, the question I have is, I'll make this my personal to be as an example. I had an appointment with my doctor, and then after the doctor, I got this cold here, and it's in my sinuses and in my chest. Now, it's not that it's, you know, making me bedridden or anything. The problem is whenever you know, okay, I have not a really compromised immune system, but it's, you know, teetering. So do I go to the emergency and just like waste 5.5 hours? Honest goodness, I can't say it any other way to make it sound better. But I'm okay with that. You know, I can go through that stuff. A lot of our people cannot do that. I am talking about the emergency room here, which there are people in our streets that would need immediate help. And we have I'm fortunate to have a doctor. A lot of them don't. And we have a walk-in clinic, and that's not open. I think it's only open till 5 or 7 o'clock or something like that. How would you alleviate that problem in an urban area, in an urban setting where this respiratory, like, what do we have? Flu, COVID, and that other one, RBS or something, whatever it is. Now that's a triple whammy there. Are there plans to have little outreach clinics for those people who, you know, I've been healthy most of my life, and when this stuff hits you, it hits you hard. So I do not, you know, I'm in pretty good health, and some of our people are not. And I can say right now, some of them are stubborn. They will not go. So do we have an outreach plan, like a friendship center, or I just hate to say this, a church? You know, do we have anything in the plans like that? Thank you.
Thank you. So I'll turn to Shannon and then to John for some comments about Doctor of the Day.
So thank you, Kelly. I always count on your good questions. You've done the right thing. You are ill, but you're not severely ill. You're not having difficulty breathing. You may have a fever, but the best thing for you to do is stay home, bundle up, drink fluids, try to stay away from other people who you could potentially give the virus to. There are people who are going to be infected with influenza A who will get very ill. We know that before COVID, influenza was by far the most dangerous respiratory disease that we had. And we had many deaths over the years of people who were, as you say, weakened immune systems, or elders living in nursing homes and other places. It's very common for influenza to become a fairly severe illness. At this point, emergency rooms are not so bad here as they are in Eastern Canada, but they are being overwhelmed, especially where children are involved. The children's hospitals back east are just like they're opening extra intensive care units and things. So we know that the viruses that are out there are very dangerous. However, for most people, if you went to emergency and sat there for 5.5 hours, you would be told You have something that's being caused by a virus. Antibiotics aren't going to work. Go home, bundle up, drink fluids, stay away from people. And if it gets worse or you have difficulty breathing, come back. But for the most part, the clinical response to those kinds of relatively mild, I mean, you may feel really crummy, but relatively mild viral illnesses are self-care. And for many people, I know in my home community, I would have been given Weekace to chew on or other traditional medications to help, but there are very, very few things clinically that can be done for the mild and moderate respiratory illnesses.
Yeah, great question. I think I'll just add shortly that as Shannon has, Dr. Shannon has indicated that the high volumes that the healthcare system is seeing, combined with the physician challenges that or the access to physicians or the numbers of physicians, is really creating a bit of a perfect storm. I think this applies to the Port Hardy question that was posed in the chat as well, is that the numbers of physicians that are available to cover all of the shifts, especially the ER shifts, and as physicians were being pulled from other areas to from urban centers to cover rural and remote centers is becoming less and less, and so that's why you're seeing a lot more hospital closures, because those physicians just aren't there to cover. What I would suggest that if you have individuals that are in your communities that are in urgent need and can't access those emergency rooms or a physician, is to use the First Nations virtual doctor of the day line. This is our virtual line that we've spoken about. And there is a triaging system that they use, that if someone who is in need of urgent care can will get pushed to the, will get immediate access. Those that, as Shannon's saying, that may be a little bit milder would be booked into an appointment. But I would suggest that to try the virtual line if you are in urgent need and you have a closure in your community.
And that's available anywhere in BC on and off reserve as well. Next, Deborah Foxcroft.
Sorry, I can probably wait because mine's kind of off topic, so I'll wait till the end.
Terry Walkus.
Good morning. Yeah, sorry for being late. It's Chief Terry Walkus of the Kwasala Nakotok Nation. I was just reading through some of the chats, and we have, like I said, I missed because I was registering onto the meeting, so I missed getting on right away. And I caught briefly about the children's Tylenol because of the shortage here. There's so many kids are sick, and it's hard because our local hospital here, we can't bring our kids there because they're closed majority of the time. So we have to take them 30 minutes away to Port McGill in a different place. So I was just reading through some of the questions, and I have the same questions of, is there a possibility of FNHA trying to get some of that Tylenol sent to our region or to our nation so that we can take care of our young children? Because a lot of I have 4 grandchildren who were sick all last week, and I couldn't do anything for them. We're lucky. I just got back from Vancouver. I was able to go to my wife was able to get children's Tylenol but they will only allow you to take one. And in regards to COVID, it doesn't. Our nation just doesn't seem to take that seriously because it still comes and goes, and I don't know how we can get help with bringing it back out there to our north region so that to get the people to over here. It seems like they just don't care anymore. Like they'll walk around, they'll get COVID, they'll tell people they had COVID, but it's not taken as seriously on this end as it was when it first broke out. And as for our elders, they get really sick. How can we get to them? They'll stay home. They're scared to go out because they don't want to get other people sick. How can we get medications to them to help them stay home? A lot of our people who are sick are staying home, but there's a lot of them, the younger generation, who get sick and are just walking around. Like I said, they don't care, which is frustrating because it seems to be being passed around, and I'm worried about the spread of COVID again. And and it's our younger ones, our younger children who are getting hit in our nation right now. And like how can I send the message that that we all know there's a shortage. People have been ordering some from friends that have gone to the States to pick some up. We don't want to be doing that because we want to be able to get something that will help our kids, because it's really hard watching my own granddaughter crying all night, every night, because we don't have medications for her. So those are my questions. I was like I said, it's frustrating that people aren't taking COVID seriously still, and that it needs to be brought to our region again to say, I don't know, like just a message saying COVID is still here. We still need to get our shots, because I believe, I've had 3 myself, and knock on wood, I've never, gotten COVID since the start of it. But, that's because I try to be safe everywhere I go. But a lot of people don't. So I just want to try to get it to our nation that, you still need to go get your shots to keep everyone safe, yourself. Because I get scared every time I see people coughing around me, and I try to stay away from that. Me being chief, I have to interact with a lot of people, but when I see them coughing, I get scared. Like I said, I don't want to be getting close to anyone. But the biggest question was about the Tylenol. Like I said, I just caught the tail end of the message. So if we can get some idea how we can help our children here in our nation, I'm pretty sure that's the same questions that, like I said, I was just reading through some of the comments, but I didn't get through them. So I'd appreciate if we can get some help in regards to how we can help our nation here. Thank you.
Thanks for your overall messaging, Chief, and your comments. And I'll turn in just a moment to Brennan McDonald to talk about some ways to support your community. I think we also heard from you a need to renew or to rebroadcast some of our messaging. We have been doing a lot of that, but I think it's good to sort of renew our energy on that, both on TV and other mechanisms. So we'll take that messaging to heart. The other thing I would just ask, Monica McElduff is on the call. Just to comment on our supplies that are there through our facilities. Monica, can you comment on that a bit? And then we will look at some of the extraordinary supplies elements that that are needed as well after that. Monica?
Great, thank
Comments?
you. Happy to make a few comments. For those that don't know me, my name is Monica McAuliffe. I'm in an acting position at FNHA as the Chief Nursing Officer. I'm calling in today from the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh. So as far as our sites that are run from FNHA, our health centers and nursing stations, we currently don't have a supply issue for those medications, which is great. I have been seeing the chats around, maybe expanding the distribution and getting some supply into community. I think, and Shannon made a comment around that too. It is something we can explore for sure. Currently, we don't have a supply issue. And I think everyone is aware that we are wanting to use the medications if needed, and that it's the people who are coming in are being assessed through the nurses and the physicians, and obviously giving it out if it's needed. And it is something that we're monitoring just to make sure that we don't put ourselves in a situation that we won't have access to the medications. So we do have Cindy, who's a pharmacist, as well as we have other pharmacists who are making sure that our supplies are and medications are coming in and are ordered in advance. Shannon, I don't know if you wanted to add anything to that around the comments around sort of a larger supply distribution to other communities.
Thanks, Monica. I think we are challenged in that, like every other service provider and retail outlet in the country, there is way more need than there is availability of product. So happy to hear from Cindy that things are starting to come in. And I think, people's normal ways to access these medications will be more available. I can't speak to local decisions about distribution of on-hand medications. Like Shelley had sent me a note saying, they have some, but they're trying to limit it in distribution. The nursing team is trying to limit its distribution in community, as you said, to people that really need it. So we're kind of stuck between a rock and a hard place. It would be good to be able to do this, and some families are lucky because they had some in their medicine cabinet and others did not. But I know that, once supplies are available, a broader distribution can be considered, but once it's available to us, it'll also be available, I would think, in the retail sector and much more available for people to go out and purchase.
Thanks. If I can ask Brennan just to give an example of a regional support for some of the messaging.
Yeah, absolutely. Thank you, Chief Walkus, for your comments, and just would offer our regional teams support in response to what you're seeing in the North Island. I know that it's important to have messages that you can share to help the nation, the members in the community, to remember the importance of protecting each other from illness. And we have on our websites to this day much that's been developed over time to help facilitate communication into communities. But we're very ready to work with your nation and others to design messages that will have impact, and bringing some of those forward again through newsletters, through, I know a lot of social media campaigns in nations that have Facebook sites and things can help to push messaging out. We've worked with some of our nations to identify local vaccination champions who are recognizable and people will pay attention to. So we're happy to look at potentially an approach like that. And I also just want to acknowledge from the North Island in particular how challenging it has been within the health system context. And I saw some messages in the chat around that. We have reached out to Island Health to seek an engagement with our nation specifically on this issue so that we can address questions you have around access to care. So I know that that's a concern, and we are working with Island Health to ensure that our nation's interests are understood and addressed as best we can in the circumstances that exist in the North Island. So just offer those comments. Thank you.
Thanks. And each region has similar offerings. So I just would say that's a good example, but each region has their specific set of offerings as well. If we can turn to the next question from Jessica Frank.
Thank you. I'm Ashna Jessica Frank, Lillooet Nation, Lillooet Health and Healing Health Director. Thank you for today. I've had so many concerns brought to my attention regarding, the shortage of supply of our medication for our children, and then also, but thank you for all this information. And, I just have a few comments. I guess it's probably more at a bigger level when it comes to the sickness that our children have, and then also the shortage of supply for communities. And, we're one of them. We get our shelves stocked every once in a while, and people are constantly checking the shelves. And it's evidence now that we see that it's been a couple of years, I guess 3 years, since our children have been exposed because we've been isolating due to COVID. But, I've been mentioning to community as well as, it's called culture, to only take what we need when it comes to our medication and our shelves. And, our teachings are in us to ensure that we don't hoard all our medications that are needed. And a lot of our families as well, they all work together, and when one child's sick and their children are better, they share the medication to the next family that needs it, and which has been really heartwarming to see in our community as well. And people are there to willing to share as well. And on top of that, I just wanted to also mention, it might be at a federal level, but within this last year, and we're looking at least another month for our shelves to be stocked up. But our families, we have families that have 5 children, 10 children, and then of course stacked households, etc. And then even our health professionals as well is we only have so much sick days and wellness days and vacation days to utilize during this crazy time. And, that's including my staff as well. I have to be so fortunate that I haven't, or my family haven't been touched with this yet, but, my son's 10 years old, but I do have numerous staff in my health facility worrying about what their next payday is going to look like, because there's a shortage of sick time and vacation time and wellness days. And so now they're looking at unpaid. And then I was wondering about nurses being able to write prescriptions. I still haven't received any information on that. And then just a concern about, how it's already December. Now we're looking at hoping the supplies will be stocked up by January. And so a month is still a long ways to wait. And I'm worried about our babies and making sure they're not getting severely ill during these crazy times. Anyways, those were some of my comments and questions. Thank you.
Thank you. And a number of questions about extraordinary supplies. So I'll ask our team to examine sort of rollout for that and what it would look like. I think it will be also related to how fast can we do it versus the suppliers. So I'll ask our team to look at that for sure. I'll ask Monica to speak to nurse prescribing. But I would say just generally on the sick time that that it may be important for communities to look at some extraordinary approaches to sick leave. I know we have, and we can give you some examples of that because you clearly don't want people to go to work if they're sick. So over to Monica.
Great. Thank you, Richard. And thank you, Jessica, for your great questions. What I can clarify is that I think around the not giving out the Tylenol at the health centers when they're saying only if they're immunized, they're giving them out when people are being, the children are being immunized for that pain of the immunization that they would be going through and the discomfort. Nurses actually can dispense and give out Tylenol. They're allowed to do that. It's within their scope of practice. And again, what was mentioned earlier, it would be because there would be symptoms or that there would be a need to do that. It sounds like we have been messaging if it's proactive, then they wouldn't be doing that. They're trying to conserve it. But if there's symptoms and a child needs the medications, they're able to do that within their scope. And so I'm wondering if there's been some request just to have the medication. And again, if they gave them out without any symptoms, then when a child does need it, they might not have enough. So I think that's maybe what has been happening in the communities, but they are allowed to give it out. It's within their scope, and they have been giving it out when the children have been getting immunized to help with their discomfort.
So one of our follow-up items might be to clarify the process for that. So I really appreciate your update, Monica. I saw a number of questions on that in the chat box. I'll turn now to Magnus Turner.
Well, up to Ama, to Okonilkwa. How's everyone doing today? Amashkeet, it's a beautiful day. Amash Nanok, Takamshwat. I am Magnus Turner, Shamalcolm counselor, and my hands go up to everybody here today. A lot of good words that are being shared. What came to my mind today, just being on this town hall, I wanted to ask interested parties that might be able to answer. You know, in today's world, we live in a fast-paced world where there's convenience, there's take a pill, you know, if you're feeling down to make you feel up, take a pill to bring yourself down. What I wanted to ask here is that has FNHA or any other pharmaceutical organizations have ever considered the naturopath or the holistic approach? The reason why I say this, you know, where I come from is the top of Harrison Lake. We always hear long time ago when they used to make fish soup or they pick some of the traditional medicines, you know, and I kind of wanted to see, you know, when there's a shortage of supply, when it comes to Tylenol or ibuprofen, you know, long time ago, yeah, they used to have aspirin and bears, but what I wanted to ask, you know, from nation to nation here, is there any other research being done that's going to help satisfy? Because, you know, sometimes we have allergic reactions, you know, I'm kind of using this as a segue. You know, I was given a prescription for my blood pressure before, and I took it for almost a week, and I had an allergic reaction to it, you know. So, you know, I kind of break it down when it comes to self-care in our environment, you know, how we take care of ourselves and those kind of things. You know, there's a lot of different sicknesses and illnesses out there. Sometimes you're spiritual sick, sometimes you're dealing with your immune because we're not, you know, building things. And I just wanted to share when there's other First Nations entities organizations. I know one, I don't know if anyone heard this one. I've been reaching out to NEPC out in Saskatchewan. They have the COVID tea. They have a lot of traditional medicines, and they also have people that are experts in finding and picking on the right time. So I'm sharing this for this table today, for this town hall, to apprise every one of us which nation we come from. What did we utilize back then? You know, we're so caught up with Tylenol. Like, you know, I got my teeth done one time, and I you know, every time I had a pain, I took a Tylenol, and then I almost got sick. Another one, when I had to take antibiotics, I didn't know that I needed to have a probiotic. So these are just certain things that I wanted to mention, you know, because, you know, I want to find out if there's anything else that we can turn to that would be recognized. You know, we have people that are, you know, like we have shortage of doctors sometimes and nurses, but I think we need to look at, you know, what's really available to our people. You know, being Indigenous, you know, this is what really matters to me. You know, I have doTERRA products here, the Sage products, you know, where, you know, some of these things might help offset my sickness, you know, and sometimes what we eat, you know, can make us sick because it's not good for us. And sometimes we're dealing with grief and loss because there's so much going on, and the deaths we've had, you know, and stuff like that. So anything the mind can conceive, the heart can believe is what I'm trying to share. And, you know, I'm just kind of pointing out for the record today, you know, we got our mind. Some people have mental illness. Some people have physical illness, spiritual, you know, and just some of the things I wanted to point out. But I wanted to ask that, you know, do we have a lot of other Indigenous companies or holistic approaches here where it comes down to our traditional medicines? So to me, that really speaks volumes back when, before we all got into this fast-paced world. So I just wanted to say thank you for having this town hall. And these are my kind of concerns right now, where it concerns our ancestors and our traditional lands and resources. Kuchtamutkalap. Thank you.
Thanks so much. Some really excellent comments, and I would say that it would be really good for us to work with our traditional knowledge keepers on an appropriate way to share information, because I know that there can be concerns about just openly sharing some of that, but I do acknowledge what you're saying to be true. That there's sort of prevention aspects of traditional medicine, but also some interventions that are sometimes unique to each nation in our geography. So I'll ask our team to start pulling together some of those good examples. But I know it's also been expressed that we've had some conversations with the Health Council about how do we have information sharing and teaching, if you would, so that our current healers can share approaches on traditional medicine with the upcoming generation. So I think there's a whole lot of really good points that you made, and just want to acknowledge that. And we'll turn to our team to turn their minds to that quickly.
Thank you.
Okay, just checking, Kelly, is that a legacy hand, or do you have a follow-up question?
Follow-up.
Okay.
One thing I'd like to know, I hope I heard this correctly, but while driving out the few days back, there was a news item about foreign doctors being cut some leeway in, so they may be able to practice. And it sounded as if BC was open to that idea. And I'm hoping that is truly not just a wishful thinking on somebody's behalf. But if it is, we could, we could sure use extra things, just because they're from a foreign country does not mean they do not have the capabilities. And the other one is, when I asked about clinics, I I've been sitting here and I didn't hear anything about it for the people. And how long, or what time limit is the doctor available? And that's another thing, could a telehealth be installed in a clinic that is made up, that is grown for the people of our downtown urban area who are quite in need of medical attention at times? Thank you.
Thank you. The foreign doctors, Shannon has had to step off, but there is an accelerated process so that foreign trained physicians can be deployed in Canada. They've reduced, they've increased the number of training slots and decreased the amount of waiting time. So I would say it'll probably be 1.5 to 2 years before we start seeing more foreign trained doctors. People trained in the US will also get some fairly quick privileges. So I think there's special measures being put in place for that. But also foreign trained doctors can serve in different roles as well. And it's something that our teams will look at as we look at our primary care centers. So there is more to come. This was just announced last Sunday, so you did hear that right. And I would say that there's also a new medical school that's been announced, which will also focus on Indigenous training within that school. But some of these will take time to be sure. But the doctor of the day is available and they will triage that. But I would say that we also are handing out additional phones in the urban areas. John, do you want to speak about that? Because there is a program for giving phones to urban folks with minutes.
Yeah, thanks, Richard. And Kelly, I guess it was unfortunate that with the Vancouver Island Caucus that the urban and away from home presentation didn't make it onto the to be presented on the last day because that information would have been shared. Is that there is a new initiative, if you remember, during the COVID period that the urban and away from home team had been we had worked with our partners at Spark BC to provide phones and tablets to vulnerable individuals so that they could reach services and like doctor of the day and stay connected with the health system as the province was shut down. We have good news that there are going to be more phones. I think it's up to, I think the number is 200 more phones per region that we're working on with our partner, and it's to be distributed to the vulnerable population to help support them during this time. So look forward to that, and I think that's rolling out shortly.
Thanks. And before I go back to you, Archie, I'll go to Deborah.
Thank you. Thank you for your time. I appreciate the information, and just want to acknowledge everyone that's doing this very important work for their people, bringing up their concerns. I just wanted to say, and I knew this was a bit off topic, but we also just, I just wanted to say, we also just lost another young person to COVID, or not COVID, I'm sorry, to the opioid crisis. And our council had a meeting last night, and we're just getting up, tired of it. And it's like, we need to do something about it now. So our community is going to have a gathering in the new year sometime to bring together all of our resources in Port Alberni and our partners, including the nations that are also living in the Port Alberni area. to have a gathering, to come up with some solutions, because we know that it's difficult for everyone, families, communities, on what to do, and we don't want our people to lose hope, including ourselves, about doing this important work. So just saying that we had a very heartful conversation last night as a council, most of the evening, about what can we do and what solutions do we have. And we really need to hear from the people that have been addicted or have come out of their addictions. One of those days will be that for our community, to let us know what do they need, what can we do. And a big concern that we brought up was, one of the things we talked about is how do we get to our youth? Because we have 10 and 12-year-olds that are taking drugs, and we have big concerns about that. One of the ideas was to actually request FNHA, and I don't know if this is even possible. We need to have some kind of youth gathering, whether it's education, have some fun, just do something with our youth. Yeah, we're concerned about this generation coming up and the ones to come. But we really think that in terms of the mental health and the drugs, we need to get to our young people. So glad to hear that there's additional activities going to happen in the near future, but our council is very dedicated and concerned about what we can do, and we want to do something. For us, it's enough talking, and we're going to move forward. So I just wanted to make those comments. I know it was off topic, but it's on our minds because of our recent loss. So I just wanted to say on behalf of CISHOT, I'm the portfolio holder, and also for health, and also proxy for our chief, Ken Watts. So I just wanted to bring that forward as some of our discussions we had last night. Chu.
Thanks, and I'm sure we'd be keen to partner with you both at the regional and looking more broadly at the provincial level for activities like that and for prospective gatherings. So I would say that would be something we'd be keen to explore further. And I think ideally good partnership would be to how do we convene such a meeting and call for it, and having sort of joint sponsors, if you would be a good way to look at that. So thank you for raising it. And I'll ask our teams to look at it. We are also planning a province-wide conference to focus on some of the specific interests that people have raised over the past few months, where good community examples would be really shared, so that we can look at how do these get replicated broadly across the province, because there's many good examples, and I think that kind of sharing will be important, and something we've gotten away from part of the isolation of COVID. But I want to acknowledge your comments, and we're looking to see how do we do this and get more into those kind of dynamics again. So I'll turn to Archie, then Shelley to wrap up, and we would like to close close to 10:30. So Archie.
Thank you. And thank you to Shot and Deb. We will support you. That's positive. That's doing something. And FNHA for offering to help. That's awesome. That's what we want to hear. And first I wanna talk about the prescriptions. Those of us that know Simon Lucas, he talked loudly about the loss of the prescriptions that we're going through. And that's a number of years ago now. And if you listen to, the people that make lots of money don't talk about it. It's the poor people that can't afford to buy the prescriptions. And, I think, I think that the communication is terrible because our rep, you talk to Les Dorn, you talk to Mariah Charlson, the number of phone calls they had to fight to get prescriptions covered. There's a lot of work that needs to be done there, and good hopefully that we can do it. And I just want to say, if we focus on managing good health instead of trying to fix everything today, that we start living healthy, our kids start living healthy, and we'll be strong again. We'll be eating our natural resources. We'll be eating our fish. We'll be having our fish soup. We'll be having our smoked fish. Drink the juice. That's medicine. And I think that we have to teach our people. They teach our kids so young to drink pop, chips, candy, Slurpees, and people don't understand how much sugar is in that stuff. And then, and then all of a sudden they're diabetic. Well, the thing that scares me the most are the really young people that are diabetic now because of the sugar intake. And I just want to talk about opioid crisis, because I want to ask a question, because what we're doing is not a solution. We can open up 1,000 homes or healing centers. But the dangerous drugs are out there freely. The dangerous drugs are out there being sold, and they're cheap, they're dangerous, and they're so available, and there's no consequences for when people die. Why is that? So I'm asking the question, are you guys part of a process where you meet with legal people and politicians to start changing things, to help us? Because we're going to run out of money the way we're going, because there's no solution in the end. A bed is not a solution. It helps, but it's not a solution. We need to go to the root of the problem and start looking at, look at how many young people have we lost? One is too high of a cost. And, we need to think like that. And, and also I think that we need to start supporting healthy people. Let them be the example. Let them lead us for a change. We're always trying to look after people that don't do well. We throw all kinds of money at them to heal them. And then a couple of weeks later, they're back to the same old, instead of supporting the healthy people, and they be examples to our young people. And so our young people won't go down that same road. And so hopefully that we can come together, that we can ask all services to come together. Deb and Tishat, I heard you say that, but we're there, we're willing to help, because youth are very important, and what we leave them is very, very scary. And I have to run away because my grandson is throwing up, and I have to get him to see a doctor. So I want to thank you guys. This is very productive. It's a nice change.
You and best wishes with your grandson. So I'll turn to Shelley for the last question of the day.
Thank you and good morning. It's so nice to see everybody. I actually have two things I'd like to address. First of all, thank you to Monica for that very exciting news about our ability to give out some of our medications to the kiddos. I wouldn't mind further clarification as to when a nurse can hand it out. Is it only during flu
flu season, or can they hand it out when, you know, they know that the child maybe broke their leg and they
Yes.
can't get Tylenol? Just further clarification on that. And then my second thing is for Mr. John Ma. It is very nice to see you, John. In regards to health benefit coverages, is it possible that when pharmacists are notified of the changes that we can be notified as health directors as well? And I'm just going to use this compound medication thing as an example. You know, I keep in close contact with my families and my parents. So as soon as you announced that compounds were covered on this meeting, I sent a message to my parents, and they sent something back that said, you know, we went down on Monday and the pharmacist knew nothing about it. So I got my health clerk to call down a couple of minutes ago, and they were totally unaware of the changes. And just to let you know that I've had a couple people coming into me, and myself included. I went to my local pharmacist to pick up a prescription that I've been getting for 12 years, and I was told that my status expired. And I said, there's no way my status expired because I'm Indigenous and I do not expire until the day I die. But they had the wrong billing process. So those are my two asks, and thank you. And I hope everybody has a great Christmas.
Okay, thanks, Monica. And then I'll turn to John.
Great. Thank you, Shelley. And I know we're running out of time, so I'll make it quick, but great question. And yes, nurses can prescribe whenever it's clinically indicated. So it's not just around the symptoms around the flu or anything else. So they can prescribe when it's clinically indicated.
Thanks, John.
Yes, thanks, Shelley, for the question. You know, I'll turn to actually Cindy in terms of what our process and what we had done with the communication is, as Cindy indicated in the chat, that we sent the notice out in around September the 30th. And, you know, some of the challenges that we have, Shelley, with our providers is that we send out the information, but not everybody reads all of the information that we do. And I'll just have Cindy indicate what we do when we do distribute it out. And then we can have our provider relations team follow up on pockets of area that may not be getting our communication. Cindy?
And so there's a process for drug shortages that our health benefits program is involved with provincially. And so that's why in September, we were able to quickly enable coverage because it was an anticipated shortage and anticipated that there may be problems we weren't sure what was going to happen with the supply chain. There was conversation about putting out early notice, but what happened in Ontario when they announced too early, it caused a massive panic throughout the communities and throughout the widespread Ontario. So we didn't announce we created that listing and coverage, but it was through community channels, but we did send it out through all pharmacy networks. So that would be through the Pharmacy Association and through the PharmaCare newsletter, which informs all pharmacists and other healthcare providers across BC. So sometimes there is some communication within pharmacy and corporate pharmacies. It doesn't always reach the people it needs to, but that was done then. So I do take your point of trying to figure out, we'll take a look at our communication strategy to see if we can do more to give some early support to our communities better in the future. But most recently, there was the update through the health benefits news, and it was just recently in November that was sent out. But thank you for your comments. I think we'll take a look at our processes and work with our CR team, our community relations team, to make sure that we can get those messages out in a meaningful way as early as we can.
Thanks, and I assume that includes health directors as part of that. So thank you. And what I'll do is draw our meeting to a close. I believe most of the questions have been answered. If there's any remaining, we will circle back and provide a written response to those. So really appreciate everybody's attendance and participation today. And now I'd like to turn to Wiccan Anish to make any closing comments and to close up our meeting. Over to you, Cliff.
Thank you, RJ, and thanks to everyone who participated and was able to
join us, and I know that some have had to leave, and I know Shannon has had to leave. I would quite appreciate number one, our authority providing these opportunities to our leadership throughout the province to have a dialogue along with our directors. And I think they're very important sessions that I know that our team takes quite seriously all of these suggestions and the broad range of issues that are covered by the questions and the issues raised by different representatives throughout the province. And I've always appreciated the town halls, and I know that our team does the best they can to follow up with issues that are raised if there's not an immediate response available. And so all of this leads to a good team. All of this leads to us pursuing that better path for our people in terms of health and wellness. And we still have a long ways to go. But I quite appreciate the issues being raised with regards to our medicines and our ways, our foods, and the issues that Tishot raised. Where I live, I live on Tishot territory. And, you know, I quite appreciate their approach and their leadership, and I quite appreciate Archie's response to the direction that Tishot is going to take, and I quite appreciated our team responding the way they did in terms of supporting such a thing and possibly having a provincial gathering to address these things. I remember in 1992 when late Simon Lucas was alive, how action can be initiated by direct. You know, he lost a son to suicide, and we had a major gathering to address suicides. And but I think that sometimes we have short memories, and we need to change that. And you know, there were some good things and good suggestions made to address the issue, and hopefully we pursue that path of good things and good suggestions being made to address serious concerns within our communities, in particular with young people. And so we are on a good path. I believe that very strongly, and I quite have appreciated the regional meetings that I attended in the north and the one on the island here. And I think that I've always appreciated our team and our health authority and how they approach these things, and their presence at these meetings are very important. So thank you, Richard, for this opportunity for the town hall. And I'll just say a quick closing prayer for our people, and wish everyone happy holidays and good times. You know, I think that sometimes we think we're poor when we have a lot of family, when we probably are the richest people around, when we have family and relatives and friends and supports. So, why Kashikaha Tatati at the Akta Kuti Stapati, who Mitsuk Patsukin Jama Patik Chachim in a pair or second. Sakshi Chaps at Moxiakati at I edited. Does she tap there? Does she tap there? She looks to me, Jeb Thomas Quine, it's the course. Be Shuko as up and old to Winnick. Books art. The bad drugs that are available. We kindly thank you, Creator, for the opportunity to come together in the town hall. Thank you for your guidance in our deliberation, and we thank you for all that you provide each and every one of us. And ask you to lift up the spirits of those that are grieving. We ask you to healing hand for those in need. And kindly ask you to rid mankind of these awful COVID-19 and its variants and the issues that our people have to continually deal with on a daily basis. We ask you to provide strength and resilience to all of our people. And we ask you for safety for all of our relatives and friends throughout the province of British Columbia. And we ask you to provide strength for our people who continually commit themselves to pursue this path of health and wellness for all of our people. Too.